Hey, it's Darik with another edition of Instagood on Now 100.5, powered by justserve.org, bringing awareness to what's going on in our community, of course, and motivating service in the process. Today, I'm with Pavan Lohia. He is the founder of Pavlyfe and the Pavlyfe podcast, where they discuss all things public health, both in the United States and also globally. Pav, thank you for joining us. And it's funny how timely it is considering the more recent events of the uptick of COVID cases, particularly with the Delta variant, local governments reinstating mask mandates. Most recently today, we saw San Francisco announce theirs. A week ago here in Sacramento, they implemented it. Really quickly, will you give our listeners a brief rundown of your position, your education, what you do in public health, so we can all better understand?
Absolutely. Well, thank you for having me. I'm glad to be here. Yeah, a little about me. Currently, I have a company called Pavlyfe Healthcare, where we focus on healthcare education, healthcare services. And obviously, throughout the pandemic, we've been providing personal protective equipment to first responders, hospitals, and various government agencies across the United States, and now even, in fact, across the globe. And in addition to that, I'm also a clinical researcher at a major New York City hospital and at the National Science Foundation as well.
Wonderful. And of course, California native, right?
Of course, yeah. Born and raised in Irvine, California. And my background is actually pretty much all public health. I went to University of California, Irvine, studied public health there, and I also received my master's of public health from the City University of New York School of Public Health as well.
Very good. What is the most difficult struggle right now for governments? You say you work with them, providing PPE, et cetera, local, state, federal, when it comes to managing COVID-19 and, of course, this fear of the Delta variant now that is now these numbers are rising as we see them every day.
So I think the biggest struggle any government agency, both in a major city, like, say, for example, New York, Los Angeles, Washington, D.C., versus a rural, or rural town in America, all these agencies are struggling with, number one, staffing shortages. So there's not enough public health practitioners, other support services that generally you would see. And considering rural America, that problem is even more deeper, where you don't have providers for, say, hundreds of miles, if you even do have those type of providers. Obviously, the federal government is working as quickly as they can to mobilize resources. The Biden administration has been working hard to allocate certain workers, also, increase the workers. Under the previous administration, there was a federal government freeze on hiring for certain agencies and certain positions. Obviously, the way the federal government brings in employees and providers is also still pretty rigorous. So they have been making some progress, but as we've seen, a lot of states have had to rely on bringing in outside help. If you look back at the very start of the pandemic, New Jersey was one of those states. They had to initially bring in nurses and doctors from out of the state. In fact, they even let medical students who hadn't finished, help take care of COVID patients because there just simply weren't enough resources. So yes, they're definitely trying, but again, I don't think that we weren't well prepared from the get-go. And even now, as the situation constantly evolves, we're trying to allocate the resources and necessary power to each of the states or cities that really need it the most.
Sure. And I think a lot of people don't realize, in fact, you made a really good point, which is, there's such thing as PPE, there's the masks and everything else, but we also often forget about the human capital, the personnel that is a shortage of as well. And that's one of the, if not the most essential part of this entire process, fighting back against this pandemic. And with a lot of job loss and a lot of people, deciding not to go back to work or changing careers, it makes it all that much more difficult in having the proper staff to be able to help in a situation like this. And it's something that I think a lot of people are not thinking about.
Exactly. Yeah. And, just to add to that, so, I working at a major New York City hospital, working on this research for COVID-19, we were also short-staffed. As one of the largest hospital systems in the country, we were struggling to find these people between, all these hospitals or clinics, wherever you want to say your healthcare services were. They were short-staffed, whether it was from furloughs, because these agencies are also historically have been underfunded. Public health has
Sure.
been historically underfunded in this country, compounded with, people getting sick, not having been, abiding by the CDC guidelines of having people in a hospital or a clinic. That added layers of challenges that, I think we honestly might still be recovering from. A lot of, whether it's in major cities or rural towns, there are a shortage of healthcare workers in all specialties, from public health all the way to medical doctors as well.
Right. You see a lot of research and you work with a lot of research in a lot of institutions. Why are some members of the population reluctant to get the vaccine, for example? If you could share some numbers on its effectiveness and perhaps, dispel misinformation or rumors, and what can we do for those people who are reluctant to get vaccinated or to follow the guidelines? What can we do to quell their fears? And what's the most effective way to keep people informed in your position?
Of course. So I think it's very hard for, I would say, when we try and communicate science in a news format, it can be very difficult. I've dealt with this on my podcast too, of, how to really convey certain information in an easy, digestible format. I think that you had a lot of hesitancy increase with the vaccine because of the politicization very early on.
Yes.
And then, we also saw the constant change from the CDC, from NIH, as well as, high-ranking government officials. And that causes a lot of confusion. So when you combine the politicization and the constant change of science, that does raise doubt in people. On one side, yes, as whether as a healthcare professional or just as a regular person, you should be skeptical of science. That's bound by nature. But there is also fundamental understanding that no science is perfect. Whether we often have referred to the flu throughout this pandemic, and when you think about the flu vaccine, also the flu vaccine is constantly adapted year over year, based on certain strains, what it may mutate to and whatnot. Obviously, there are unintended consequences to that too. Not everyone that gets the flu vaccine is going to not get the flu. That's just simply not how it works. And I think we're seeing that now, right, where people have gotten the vaccine, are getting hospitalized or getting infected, obviously at a much lower rate, but yes, it's still there. And I think that hesitancy between the talk about it in the media, but then also, within the community that you're around, you have to look at the educational levels, you have to look at, historically, have certain groups been, marginalized in healthcare? So, which is very common. So the Hispanic, African-American community, they've often felt very hesitant of, government pushed healthcare or mandates. And that's not just for COVID-19. This is a decades-long problem, both in public health and in clinical medicine. And so I think, the Biden administration has done a good job of doing outreach, but I think many people would say it's been a little slow, which, again, to reach such a large population, especially in certain areas, it can be challenging for any official or any agency to do so. But I think that the reality is going to be, outside of incentives that they're offering, like, hey, we'll offer you $100, a lottery ticket, theme park ticket, or
which California has done, of course. Yeah.
Exactly. Yeah. We can add incentives, but ultimately it breaks down to education and breaking those barriers to access also. In just my personal opinion, I don't know if the best move was to roll out the vaccines necessarily to group by group. And we obviously started with the elder group, which, when we looked at the numbers also, the transmission was not coming from them. The transmission was coming from younger groups of adults that were truly infecting others. And so, even those things, those add barriers. You had to, if you weren't in that group, then you had to have some special exemption to get it early, like a healthcare worker, a first responder, and appointments. It's hard to, if you're working a, hourly job or a job that doesn't give you the flexibility, it is hard to get into a 9 to 5 appointment at your local doctor's office, pharmacy. So those are challenges. I do know a number of cities and number of cities and states are going about closing up major vaccination sites and going through, mobile clinics or, at major sporting events, concerts. I believe they're even considering offering it at airports as well, where, it would be a lot easier to access and, also at your own convenience as well. So
Sure.
there is some hope on that end.
As a layperson, not in the realm of public health, of course, as a member of the media who oftentimes had to report, if you will, on what was going on during the pandemic and even currently, it was hard because we did see a lot of conflicting messages, and I can understand psychologically how that makes a person feel. Because I'm like, well, what the heck do we do here? Do we get it or don't we get it? Or do we wear a mask or don't we wear a mask? And what do we do? And so it's not good when there is a conflicting message. You're right, because people don't know who to trust anymore. But there is, like you said, science is science, and there is a baseline level of understanding that is done methodically. There's a scientific method that is applied to vaccines and to the implementation of these rules and these mandates. But like you said, it's not always perfect. And we see that. And I think a lot of people right now are hearing about the breakthrough cases. For example, this case in Cape Cod, where there was about 800 people at a party, 75% of whom were vaccinated, yet they were still experiencing COVID symptoms. And people hear stories like that, but they forget mathematically it's still a small or perhaps nominal percentage of the population who are experiencing that.
Of course. Yeah. And, to that point, I think early on, many people probably remember the Johnson & Johnson debacle when their vaccine came out. People were, upset or refused to take that vaccine because they had heard of those blood clot cases.
Yes.
But even in that, when you looked at the numbers, those were 6 cases out of the million doses that had been administered. And that's once you break that down into percentage, that's a small number that would happen for any major drug that would be out on the market now. There's obviously going to be side effects. But, speaking outside of vaccines, just to give people assurances, this happens with a lot of scientific news. The common one that I love to refer to is, the glass of red wine that's going to make you live longer, make your heart healthier. You hear so many stories about that. And truthfully, yes, in some cases it may be true, but not all those studies are properly, reported or The mathematics are often left out, and I think it's more of what grabs the attention of people up front.
Yeah. In the last 18 months, and I cannot believe it's been essentially that long since since the pandemic really kicked into full gear and everything started shutting down. What ways have hospitals and healthcare institutions been affected the most? How have they changed and handled the way the pandemic? What I mean to say is, how have hospitals fundamentally changed the way they handle the pandemic, and what does the future of healthcare look like now after the last year and a half of their experience? I mean, in many cases, they were kind of not to say they were winging it, but they were figuring it out as they went along. And how has it fundamentally changed now?
Yeah, so that's it's kind of tough to put that into an easy perspective, because prior to the pandemic, there was a large shift in hospital availability in general. Because of certain provisions in our healthcare system and laws, there were a lot of rural hospitals and clinics shutting down throughout. This is, throughout different administrations. That had already been occurring, in addition to the caps on how much they can spend on certain things. When you combine all those heading into a pandemic, we were not well suited. This has been widely documented that the United States health system would not be able to handle this at a very high level prior to even this pandemic. And there were many warnings about that. When you think of it now, after the hospitals, doctors, whatnot, have gone through it over the past year and a half, I think it's still very, adaptive as to how they approach it. Obviously, certain things like medical supplies and things, they're trying to strengthen their supply chains by either producing them locally, in-house, however that may be. But as far as, ultimately it's going to break down to the resources that they can have. When you think about it, sure, a hospital in New York City can afford to have 10 doctors on call 24 hours a day. If you're in, and this is just a random state, but, if you're in Kentucky or Mississippi, that hospital may not have that capability to have these providers or support staff on hand at any point in time. So, and not only that, the way these hospitals are funded also, they're generally, reimbursement from insurance, other, cash payments and stuff. That was not the case with COVID. There was a lot of confusion early on of who's actually going to pay for all this care, whether it's,
Right.
the people who are in the ICUs, and now we see it with the vaccine. There's a lot of cost that now the federal government is going to have to absorb. Moving forward, that is going to be a big discussion amongst any medical provider who has a practice and is
Sure.
offering these services, whether it's a hospital or your local doctor's office. Those are absorbing costs to keep things like oxygen machines, ventilators. Those are not, cheap, and they're also not, necessarily covered by insurance in many states or by many policies. So I think you're going to see probably a more fundamental shift to states, if not the federal government, creating, reserve funds, or also just, working with insurers around the country to better provide or be better adaptable to this. But in my full confidence, I cannot say that we are ready for another pandemic of this scale,
Sure.
both nationally and globally, because
Yeah.
we don't even have a way to gather all the proper information just within our own 50 states and territories. So before we get to the level of, hey, how are hospitals going to handle this? We need to even have a better idea of what is going on in our country.
Right. That's very true. And my next question, and I think you kind of answered it, was: do you believe, based on what you know about public health and your involvement in it, do you think that we are able, as we see these numbers, and it's scary because, like I said, as a layperson, I'm nervous every day, and imagine you are too, watching the Delta variant take a grip.
Of
Do
course.
you think that institutions, health institutions, healthcare institutions are able and well equipped to handle another surge, so long as it's not at the level that it was when it initially started?
So I think resources wise, I would have full confidence in many of these places now being able to, support a major wave. I think ultimately, again, like we started off, was resources. You are seeing a significant burnout amongst healthcare
Yeah.
professionals, if not also, there's this new kind of topic being floated around, is the post-traumatic stress from this affecting healthcare
Sure.
workers on all
Sure.
levels. So I think when you're having people, I mean, I'm part of it myself. When you're having somebody work 80, 100 hours a week,
Right.
for months, and now over a year on end, there's going to be some tax, applied to that person, as well as the type of care that they're going to provide.
Sure.
Early on, we saw that there were blanket diagnoses. We were just assuming things because there wasn't enough testing. Obviously, things have gotten better from that, but if we're going to move forward and really actually absorb some learning from this, we're going to have to do better in terms of like, hey,
Yeah.
we have to dedicate certain resources to identifying trends, and then allocating certain resources, manpower,
Yeah.
supplies, if and when something happens. Those were things that we didn't think of then, but now that we have had this experience, we've definitely gotten better with keeping up stock, keeping supplies
Yes.
stored. But we do still need that human capital to provide these services ultimately.
Sure. Sure. And the human, the psychological, emotional component to all of this, having friends that work in healthcare, doctors, nurses, staff in hospitals, both in the Bay Area. I have a friend in New York, and she said, I am just about to have a nervous breakdown. And it's been a lot of pressure on people in the healthcare institutions, in the industry. It's been so much pressure on them. And like you said, they've been going hard for over a year now on end. And the stress has been tremendous on them. What do you think that that people can do, that are watching and listening, that can perhaps help ease the stress? What can they do?
Of course, obviously, number one is get vaccinated if you haven't gotten vaccinated already. And if you're still hesitant about getting vaccinated, definitely speak to a healthcare professional, to discuss your concerns. But I don't know necessarily as much like what one person or an individual can do to help healthcare workers, but I've definitely seen community outreach. As we saw, like in places like New York City, the nightly, shows a show of respect to
Sure.
our
Sure.
first responders, healthcare workers.
Right.
If you do know somebody in your circle, your social circle, family, they are healthcare providers, maybe offering assistance with childcare, which has been a struggle for a lot of providers.
Yeah, that's
In fact,
very hard.
I know that that's one thing that kept even providers that I know and I work with on a regular basis, that kept them from being able to help throughout the pandemic because they simply didn't have childcare. You know, offering provide a meal and stuff. Those little things can go a really long way. And ultimately, I think it really just boils down to the respect given to the healthcare workers as a whole, whether you're a nurse, you're somebody who's just, helping the providers like a doctor or nurse. Everyone is integral to making the system work. And just respecting that can go a long way.
Yeah, I've so many of our listeners work as nurses and doctors and at hospitals all over Northern California. And what you said is right. So many of them just don't have the opportunity to find somebody to take care of their children when they are needed the most. And they're often forgotten about. Those basic things are forgotten about, and it puts a lot of stress on them. Here's a really important question that I suspect you probably have a really good insight on. What do you think the government can do better, local, state, federal, to help the communities and help the United States and ultimately globally help to rise up and to break away from the tragedies that this pandemic is causing?
Yeah, no, that's a great question. So I think this is going to be a multifaceted effort. I'm hoping to see some changes, obviously, in this current presidential administration, but overall going forward, we're going to have to work together, not only just in the United States, but globally also. As far as the federal government comes in here in the United States, I do think things like this child care tax credit, those can be very helpful to struggling healthcare workers or those that need more resources. But also, speaking of childcare, those are very expensive no matter where you are in this country.
Oh, yes.
And that's a very big burden, including education, right? A lot of students have been out of the classroom, so to say, for the past year and a half, and that may continue in many states. Not every school district, colleges, they're not all open to 100%. So allocating funding to certain, basic needs that some of these people need. Again, I think the thing that we also get caught up in is that, healthcare workers are, highly paid individuals and whatnot. That's not necessarily true across this country. I can tell you that. And the other thing is a lot of these people have not been compensated properly throughout the pandemic. There have been reports all over the country of people working either when they are working overtime, they're not being compensated because they don't have enough money to pay them, or it's just not part of their job description. But that is also a very big thing. We've not given a lot of these healthcare workers proper hazard pay, proper compensation for these services. And that is huge. The conversation is, apart from just COVID right now, that conversation has shifted now to firefighters, right?
Yes.
So on the West Coast, half the West Coast has been on fire.
Our state's burning down, man. Yeah, it's terrible.
And they're paying the federal firefighters $13-14 an hour. That's not gonna, if I'm gonna go risk my life for $13 an hour fighting these fires, I have a family to take care of. I might have kids.
I know
what's going to happen to them. So whether it's federally or on the state and local level, we are going to have to allocate, I guess, more financial resources to these providers and to the community that, provide these services. Educational outreach is also very big. These social services, so to say, are critical in making this happen. It's not, I think as Americans, we often tend to think of healthcare as, hey, I have a disease or I'm sick, I need to go see a doctor. There's quite a number of steps between that can generally be taken to prevent that. It's not only more cost efficient for an insurer or community, but also for the individuals themselves. If there's proper nutrition, proper access to education, even proper access to healthcare as a whole, you are going to significantly reduce that burden versus, hey, you're now sick and the first thing is to go to an ER. Heck, taking an ambulance in this country costs $2,000. So somewhere we have to allocate those funding resources away from certain things and focus on things that are actually going to affect us.
Well said, and I agree. And as my listeners always tell me, I hope our healthcare workers are getting combat pay, and I think that's what they think of it in their mind, right? Because that's they're on, when we talk about being on the front lines, it's not even hyperbolic. It's the reality. I mean, when this pandemic started, they were literally risking their lives, and many of them lost their lives. And so we think about these heroes, genuinely heroes, these angels in our society, like nurses and doctors and our firefighters, like you were saying, putting their lives at risk, in many cases, not even being properly compensated for it. So I would like to see that change too. And I agree with you. In your position, are you seeing any really interesting scientific and technological advancements being worked on that perhaps could prevent future outbreaks?
So I think more on the scientific side, there's obviously a lot of research being done right now. A big focus on a lot of teaching hospitals, and to those who, just to clarify, teaching hospitals are generally hospital units that are connected to some sort of medical school, university,
like UC Davis, for example. Here,
right? UC Davis, well, the UC Health System. New York has a similar system. They're focusing on a lot of research for the vaccines. Obviously, if there's going to be variants, like we've been seeing in other media reports of booster shots, there's obviously research being done on that end, but also just focusing on COVID as a virus, we have to look at how it may impact somebody who's had it and what those long-term impacts are going to be, because we are starting to see that people who were infected with COVID and had moderate to severe side effects are having long-term issues, whether it's difficulty breathing, not being able to get their smell or taste back. There's a number of those things also that people are working on, to whether there's going to be some intervention with certain medications, if there's some therapy, exercises, who knows, but those are areas that are being focused on. I think it is tough to say that, focusing on how to prevent something like this, I think that prevention level is going to come from a better reporting standard. I think from the very early on, we actually do not have a global disease reporting center of any sort. I guess the example you could kind of equate it to is earthquakes and tsunamis, right? If something is happening in Japan or a part of Asia, the U.S. centers know that, okay, hey, this seismic activity has occurred, or this type of water activity has occurred. Sure. We don't have that system with, major diseases or any diseases for that matter. So, and nor do we check that. We check that, oh, are you bringing in produce or meat that is potentially harmful to the United States, but not infect the person if they're properly vaccinated, if they have a disease, if they're running some sort of infection. Those are very critical, not only just nationally, we need that here in the United States, where states are either required to or voluntarily report it. Many states chose to just report that they had X number of cases, but then no follow-up as to people who are recovering, what stage they are in the disease, any other compounding diseases. We don't think much of it, but those are all very critical factors in understanding the progression of a disease on a national scale and an international scale. So I would say that our communication needs to be far better in terms of this, because forget COVID, this is just going to be a thing as the global population continues to grow.
Sure.
And as we continue building into unknown or newer environments, so to say, we're going to have these more interactions between human life and zoonotic life, as they say. And yes, there are diseases out there that humans have never interacted with, and we simply just don't know how it will till it happens.
Right. I think that if this pandemic has proved one thing, there's no doubt, not only nationally, globally, we were woefully unprepared. And the other thing, and to add a positive note to this, the resilience of human beings. We are trying so hard to rise above this and to figure it out, and to use science and to use empathy to be able to improve and to be able to maybe see a light at the end of the tunnel from this pandemic. Pav, I wanted to thank you again for joining us, and also give you a plug to the website really quick, pavlyfe.com. That's Pavlyfe. I was clicking around on the website. You have fact-checking COVID-19. You also have ways that I believe you have a link for community outreach as well, if I'm not mistaken. And there's a plethora, a hub of plenty of different information that you can get. Not only that, I encourage you to check out Pav's podcast in the past and future. I know you'll be posting more. There's episodes there as well. So Pavlyfe.com. It's a great site to get to for information on what's going on with COVID, and of course, public health's role in all of this. Pav, I really appreciate you taking the time today once again. Thank you so much for joining us.
Thank you for having me. It was great to be here and share all this information. So
absolutely
helpful.
It was very much. Anything you wanted to add before we go?
Nope. Get vaccinated, get tested, wear a mask.
Very good. Common sense, right?
Exactly.
Very good. Pav, I appreciate you joining us. Thank you so much for your time, and take care, and thank you for everything that you do as well.
Thank you.
Thank you.